been muted.
Magistrate Jennifer Bowles has seen countless children come through Victoria's child protection and juvenile justice systems. Despite their young age, many of them have had complex drug and alcohol addictions and a history of terrible trauma.
It's a voluntary system. Many of them, due to their substance abuse and their trauma and abuse and neglect, often can't remain at the detox facility. They just walk out.
As in the case of Maria Liotos, highlighted on the ABC last night, children in residential care units are also free to come and go as they please. Frustrated by what she was seeing, Ms Bowles used a Churchill Fellowship to study alternative models of care in Europe and New Zealand. She says forcing highly vulnerable children into treatment was a model worth considering here.
I'm just very sad that I don't have that facility at the moment as an option for the children here in Victoria. You know, I'd love them to have the chances that I saw other young people overseas having.
Child welfare experts welcome the plan.
Victoria needs, for a small number of young people at different times in their life, they'll need secure residential facilities that are therapeutic in nature, that treat their trauma and make sure that they're safe at the same time.
Ms Bowles, who spoke to the ABC as a Churchill Fellow and not as a representative of the court, has presented her report to the state government and the Department of Health and Human Services. The response has been muted, perhaps due to the high costs of such a proposal.
Well, the long-term costs are going to be a lot greater if we don't do this now, and that's because the young people are going to grow up to be, in economic terms, non-productive members of our community. They're going to end up in psychiatric wards, in adult prison, and we know the horrendous costs associated with that.
However, a spokeswoman for the government said it would not consider the proposal as there was limited evidence forced treatment works. Dan Oakes, ABC News, Melbourne.